Hi, I'm Anjali.
And I'm Martha.
And welcome to Public Health on Duty, where we talk to some of the most inspiring young minds in the Philippine public health system. Join us as we talk to our guests about their stories, learn about their career journey, and chat about their wins and everyday challenges. So, Martha, we have a very special guest today, a doctor to the barrios turned science communicator, and a very dear friend of ours, Dr. Meng Maddumba.
We're so glad to have you, Meng. Please tell us about your pronouns and maybe start off with a little about yourself.
All right. Thank you for having me here. So I'm Meng. I'm a public health physician. So I've been working for the health sector for 6 years now. And I love, ano ba sa? Balot. Ayun yung una naisip ko, balot. Di ko alam, nag-crave ako ng balot. But yeah, parang yun yung cravings ko for today. So yeah, I love things that are not conventional.
Ikaw ba ang type ng person na sabaw first or yung sisiw muna?
Sabaw muna. Kailangan mo nang merong preparatory dun sa tongue mo.
Parang may mga tao bang check muna?
Oh, may mga tao na tinitinidor nila kapag social sila. Tapos,
culture.
pangpatulak yung sabaw.
Or maybe because the sabaw is like the best part for them. And may mga taong ganun, di ba? Parang delayed gratification. Hinuhuli talaga nila yung pinakamasarap.
Or baka psychopath lang talaga yung mga nagtitinidor ng balot.
Exactly. Nagtitinidor sa balot.
So, Meng, Anjali mentioned that you're a doctor to the barrio. So, what made you decide to pursue the Ttdb program after med school?
Actually, this is very interesting, no? Initially, wala sa mapa ko talaga to be a doctor to the barrio. So, it's actually out of accident and out of love.
Oh.
That sounds like an unplanned pregnancy.
Pero seriously kasi, I just joined my partner, no? Sa Ttdb program. At the get-go, I want to be in residency na agad after I graduate. But since pag-ibig at pagmamahal, sundan mo ang tinitibok ng puso mo, sinundan ko yung partner ko. But eventually, I found my true love, which is public health.
So I found my true love in San Marino. Charot. Not sponsored.
Yeah, so parang ganun nangyari, no? So I went there. Basta dalawa lang sinabi ko, I want to be with you. I want to be in a coastal community. Never did I realize na parang mas na-in-love pala ako dun sa community work more than the person.
So you were deployed in a coastal community?
Yes, it's actually in Dinagat Island. So this is a 4th-class municipality north of mainland Surigao. So kailangan 2 hours boat ride to go there. And this is just the island west of Siargao. So maganda talaga yung area. Yep.
Wow, so you stayed there for 2 years, right?
Yes, for 2 years.
So can you tell us more about your experience as a DTTB?
Well, DTTB is a really nice experience, no? Ang dami mo talaga matutunan dito. But initially, ang palaging naiisip namin, actually yung ng mga tao, when you go to DTTB, you're there to change the world. You're there to help the people. Parang ikaw si Superman who will change the health system. So there's some messianic complex na parang, I'm gonna change the world. But hindi eh. When you actually are working na in that particular place, you can see that more than you helping them, it's them helping you help them. Parang gets ba? Na parang it's a more of a push and pull system na mga kailangan for you to develop that area. So, sabi ko nga 2 years working in the area is a very short time. So parang spec lang talaga siya sa timeline ng life ng community na yun. And palagi nga sinasabi, actually yung sinasabi na parang it's a progressive realization. Hindi bigla-biglang there would be changes. Yes, you could start something, a program, a health systems reform, but it won't happen overnight. Not in 2 years. So talagang matagal talaga siya. And that's something that siguro hindi alam ng mga ibang DTTBs, so who wants to be DTTBs, na you can see the product agad-agad.
Wait, so your role as a DTTB isn't just as a clinician in the area, but also a public health manager?
Actually, yun yung sabi ko nga, pag yung nag-usap-usap kami mga DTTB friends, when we entered the program, akala namin mag-klinika lang kami, pupunta kami sa mga baryo, stethoscope, thermometer, reseta, but it's not the case. 20% ng work mo as a DTB is on the clinical side. 80% would be on management.
20% lang?
Yes. So parang for 8 hours yun, no? Yung morning na yun, mga 8 to 10, 8 to 12, you're doing consults. But for the rest of the afternoon and for the weekends, you're doing administrative work and management work. Kasi you're managing the 6 pillars yung medicines and drugs, how would you acquire them, yung mga health services, paano ba yung mga service delivery networks ng mga barangay health station nyo, HRH mo, paano yung isi-schedule yung pag-rotate nila dun sa RHU.
Right.
Yung IT and infrastructure, paano kayo magda-download ng mga data, paano kayo mag-send ng mga claims for PhilHealth. Financing, magkano yung itataas ng budget nyo for the next fiscal year. So, ang dami talaga nangyayari outside the clinical work.
So, this is also your first stepping stone, I guess, to national government work, was it?
Well, yes. Kasi parang after 2 years, I was actually parang wanted to stay na talaga doon for good. Kasi there's a position for provincial health office that will open anytime soon. Yes. But again, sabi ko nga, dahil pag-ibig ang tamang daan, ay gusto ko nang bumalik sa Manila. Kasi my partner is also going back to Manila after his 2-year stint in the Doctor to the Barrios. So yun. So punta ako doon ng Manila. Pero basically, sabi ko nga parang it's an accident again. Kasi parang when pumunta ako ng DOH at the central office, I was asked to be a part of the Office of the Secretary where I met you guys.
Fun fact.
Yes. So at that time, actually, the landscape of the Philippine health system is changing. Kasi sign lang ng UHC law. And the recent passage of the UHC Act, the Philippines was the very window. It's an opportunity to actually look into how things work. So from a micromanagement level and perspective sa island, sa municipality na mayroon lang 24,000 people, now you're looking at a very large population, buong Pilipinas.
Right.
It's macro management. So the questions on how do we align our efforts by the Department of Health and how do we align the goals of the people, yung key benefits nila in our services. How to make these programs and projects very responsive to the needs of the people and efficient for the implementers as well. Kasi doon rin nanggagaling yung mga galing sa ground eh. Ang hirap ng mga polisiya, ang hirap tutukan, ang hirap sundin. How do we make it simple and at the same time, very effective and very efficient? So yun yung parang mga points why I wanted also to go to DOH sa central office to look on those things.
Right. You mentioned already that you were an executive assistant in the office of the secretary, but the bulk of the work that you're doing right now is on comms. Can you walk us through with that experience? How did you end up doing comms work?
Merong theme song ang life ko in DOH and public health is Accidentally in Love.
Alam mo, ang dami mong accidents. Parang feel ko, ang dami mo ng panganay sa lagay na yan.
Ang daming accidents.
Accident talaga siya because when I entered the office of the secretary, I was actually handling different teams, different work stream talaga. So I was in charge of the coordination of OSEC with the administration and finance management team. We have the health facilities infrastructure and development team. And yung last yung procurement and supply chain management team. So, sa tatlong yun, wala talagang comms work at all. But on the sidelines kasi, I was handling the DTB Facebook group,
Ooh.
So I was doing other materials doon, communication materials, IEC materials on different health concerns, yung mga explainer videos, explainer cards. And I think that became a platform kung paano ako napunta sa comms, It was around July 2019, if I'm not mistaken, na parang yung one of our EAs umalis kasi siya yung dating MRU chief. And the position was vacant. So I was asked to be the MRU chief noon. It was the time of Yusek Eric Domingo as a spokesperson for DOH. And nag-transition na hanggang na umabot kay Yusek Rosette Vergere as the spokesperson of DOH. So yun, accident lang talaga.
Right.
Happy accidents.
Pero these accidents, fortunately, really turned into real work, and actually achievements for Meng.
Well, actually, I think comms work is one of the most visible in terms of outputs of DOH because a lot of it is also like on social media. A lot of it is also the engagements that we have on ground. So, but I think an important question to ask is, what's the difference between regular communications and health communications?
Actually, parang it's the same naman, no, when we talk about the principles of communication. So there are, I'm always telling the team, no, when we communicate, we should abide with the 7 C's of communication. So it should be complete, it should be clear, it should be concise, courteous, correct, and considerate to the people, no. So on those aspects, talagang parehas lang siya with communication. But I think the very stark difference between health communications and other communications is that health comms is never neutral. Hindi siya just. Hindi siya balance on both sides because it is always biased towards the health of the people.
Right.
Yun yung difference talaga. You will always side with health and then negotiables, no? Yung mga kailangan talaga para ma-produce yung particular outcome na to. So there will always be the call to action sa mga health comms natin. Hindi lang, these are the facts, end of communication. These are the facts, these are the things that you need to do. Okay? These are the things you need to consider. These are viable options that you can partake in so that you could be healthy.
Right.
So palaging may call to action.
Right. Relating it to COVID, no, hindi lang siya, these are the number of cases today. These are the number of deaths. These are the number of recovered cases. Talagang, you have to abide by the minimum public health standards. You have to isolate when you're sick. You have to quarantine when you're a close contact. So talagang laging may call to action for the people.
Yes, and palagi may angulo. So ito yung ginagawa natin kaya bumaba ang kaso. Ito yung hindi natin ginagawa kaya tumataas yung kaso. There's always an angle to it. Siguro one difference pa is that health promotion communication is actually health marketing also. No, binibenta mo talaga siya eh. So I think I have a little exercise, so indulge me with this exercise. No?
Okay, go.
Just to prove a point kung bakit siya naging health comms.
Go.
Mm-hmm.
So you're selling a jacket.
Mm-hmm.
It's a simple jacket lang. But for Martha, you're gonna sell it to an adolescent boy.
Okay.
Tapos for you, Angeli, for a new mother.
A new mother?
Yeah, kapapanganak lang. So how would you sell that jacket? Sige, let's start with you, Martha.
Oh my God. Hey, do you wanna look trendy? Do you wanna be fashionable? You should buy this jacket. It's crop. It has the Pantone colors. Yeah, buy this jacket.
Alright, so yun yung angle ni Martha. No? Let's go to Ange.
Pockets. There are big pockets in this jacket. Also easy boob access.
Okay, so ganun, no? So nakita nyo, we're selling the same service. So I'm relating it, no, na parang the jacket is a service for the people.
Right.
But you're selling it to different audience. So sa'yo, pag adolescents, you always go with the self-image of the target audience.
Right.
But for the new mom, it will always be the utility of the jacket. But you're still selling the same jacket.
Right.
Yeah.
So yun yung maganda sa health comms eh. You're actually marketing it and you're being very creative on how to push your agenda.
So Mengi mentioned earlier that you were head of the then media relations unit. Especially when the pandemic hit, no, the pandemic was declared. So, and of course, no, because everyone was looking at the DOH for the right information. Everyone was looking at the DOH. Ano nga ba yung COVID, diba? How do you get this? How many cases do we have now? So, how did your team ensure that the public received the right information about COVID-19?
Okay, so medyo madami tong answers actually kasi multifactorial rin to eh. But let's start first with the strategy no, on covering all possible channels of communication. In comms kasi we have this hierarchy of communication effects. No?
Mm-hmm.
Na pag sinabi natin, there are levels eh. First would be the exposure. Second, people will understand it. Third, people should approve of the message. Fourth, there should be an intention to act. No? And last, they will act on it. So dito sa hierarchy na to, assuming yung exposed mo are 90%, ang dadating lang dun sa acting stage mo would be a mere 10%. So kahit 90 million yung nakarinig ni nun, a little portion of it will only do the particular behavior that you're asking them to do.
Right.
So what do we need? We need to expand the exposure of all our communication materials. Dapat on all targets, on all aspects, meron kang communication channel.
Right.
So yung platform natin usually before the pandemic, we always use the tri-media. No? When we say tri-media, we're using broadcast TV, broadcast radio commercials, and then we have the print ads, the newspaper. But on the changing times, and syempre grabe na yung technology ngayon, we have emerging media. No? So we utilize greatly yung ating social media platforms. FB, YouTube, Viber, Twitter, to spread the information. Kasi yung pinakamabilis eh. At the same time, it's very cost-effective. It's free for the government.
Right.
Diba? So parang madali talaga matouch yung mga tao. And we had innovative channels. No? So we have the Viber group no for lay people and for healthcare workers. Nung unang panahon yung pinakapatok na parang every 4 p.m., tututok na yung mga tao dun sa phone nila to see how many cases there are. No? And we also have yung mga other innovative ways like we're actually partnering with yung mga online shops. No? So I'm not advertising pero we have segments and we have plugs dun sa Lazada. So sumasama kami doon. So,
oh my God, sa mga live selling.
Actually sa live selling. Yung mga live selling nila, bigla na lang kami intro na, hey, ganito ganyan.
Live
this
selling
is COVID, this is health. Truly. So dapat very creative talaga para makuha mo lahat ng mga audience. No? We also are having this advertisements at dating apps. So this is only for COVID-19 for other health programs as well.
Really?
No? And we also have yung mga Kumu natin. So may Kumu na rin ang DOH. So wait for it, lalabas na pa yung Kumu namin. So again, we need to be creative and we need to expand our platform so that a lot of people, the majority of the Filipinos can hear our messages. Again, going to the point na pag ito yung X number of exposed, a portion lang yung who will act on it. So kailangan natin expand talaga.
So Meng, going back to information about COVID, of course, COVID information is really huge and complicated. How did your team manage it?
Yeah, especially for different types of people.
So when we communicate to people, lalo na malaki yung audience natin, we utilize this human-centered design. Communication will always have a science behind it, a framework behind it. And for our team, medyo apologies kami for Hcd na framework. No? So what is this Hcd framework? Actually, yung Harvard Business School defined it as, let me read, problem-solving techniques that puts real people at the center of the development process to create products and services that resonate and are tailored to your audience needs. So by the word itself, actually, template mo lahat ng produkto mo, lahat ng services mo, doon sa sensitivities and to the key benefits of your target population.
Interesting.
Yes. And with this, may steps rin siya actually. We have 5 steps in this HCD, no? Para makuha natin yung sensitivities ng mga tao. We need to empathize. We need to know what are the needs, the barriers, ano ba yung enablers, no? Ng particular service and for this fact, yung COVID-19 interventions. So also to define a shared vision. Ano ba yung gusto natin sa program side? And also, yung key benefits of the people when we talk about COVID-19. After that, we ideate. Ito yung pinakamaganda, yung we strategize. No? Ano ba yung employ natin na framework? What are the communication models and theories that's most appropriate for this particular COVID-19 response effort? And yung prototyping. No? So ito na yung gagawa ng mga developing the media mix. So dapat it's a good balance between above-the-line communication and below-the-line communication. Okay, when talk about above-the-line communication, ito yung mga national TV, social media cards na makikita na ng tao. But also, very important pa rin, lalo na sa Pilipinas, yung konteksto na nasa barangay yung mga materials. So yung mga tarpaulin mo, yung mga flyers mo, recorridas. So sa mga barangay, uso pa rin yung may tricycle o merong jeepney na merong mga speaker at nagbobombard ng mga jingle, nagbobombard ng mga health messages. So, sa urban area, hindi masyado okay yun, no? Parang ano yun? Pero sa mga barangay natin, yun yung talagang okay. So, we need to have a good balance between that.
Right. Kahit nga yung mga sticker lang sa jeep, di ba? Sticker sa mga tricycle, di ba? Posters na nakabit sa mga health center.
Yes, okay. So, yun yung tama yun, no? And after that, we do the testing. FGDs, small group discussions, and pitch presentation. So that's first, human-centered design in your communication. The next thing is defining the audience. No? So ito palagi sinasabi ko sa team. As much as we want to have everyone in the Philippines to know of our programs, of our communication efforts on COVID-19, we need to focus. And focus demands sacrifice. So you cannot cover all the people talaga, but you should know who needs to be in the know. No?
Right.
So doon pupunta yung audience segmentation. So kailangan mo mamili, sino ba yung mga decision makers? Sino ba yung mga major na mga key beneficiaries? At sila yung tutukan mo. Then after that, you go to the psychographic segmentation. No? When you talk about psychographic segmentation, ano ba yung gusto nila? Gusto ba nilang to have this particular health outcome? Ang motivation ba nila is for freedom of restriction or stability of work? Or ayaw lang talaga nila magkasakit. So yun yung mga tututukan mo when it comes to COVID-19 communication. And last siguro yung timeliness. No? So, there's no excuse para hindi ka timely sa information.
Yeah, especially in COVID times.
Especially in COVID times. Maalala ko when it was starting, we were just 5 in the team. Imagine 5 persons handling the communications for COVID-19 during the first part of the pandemic.
Oh my God.
National level to.
National level yan.
Oh my God, I can't imagine. Natutulog po ba kayo nung time na yun?
Hindi. Actually, alam mo yun, gagawa ka ng content for a social media card or PR. Ako na yung gagawa ng content. Ako pa yung gagawa ng layout. Ako pa yung magpapapost. And then after that, next content na naman ako. It's a cycle.
Tapos ikaw pa yung TikTokerist. Oh my God, kakapagod.
Sobra. And the talent fee, nada.
Baka ikaw din yung cameraman na. Charot.
Hindi, yung one of the 5 yung cameraman.
So makikita nyo sa mga initial materials ng DOH, yung mga tao doon are the staff of the Department of Health. So sila yung mga hinahatak mo. Na parang, halika, kailangan ko ng lolo-lola. Kukuha natin yung person from the admin office. Ma'am, ikaw muna mag-lola. Tapos kung kailangan medyo bata-bata, Peach, halika muna dito. Ganun. So yung mga kaibigan mo rin. So again, it's not an excuse na you are, wala ka masyadong tao, wala ka masyadong resources to be timely. But then again, a challenge to improve on your processes. Sabi ko nga, progressive realization. And eventually naman, we created a good team. No? Hindi na kami ngayon masyadong ngarag when it comes to health communication and promotion.
Right. And you just have to be really creative. I mean, diba, if you're 5, you just really have to get the people around you and say, do you want to be in a commercial? Do you want to be on a TikTok? Let's go.
Yes. Actually, nung time na yun, parang walang option na humindi ka.
Oo nga, napilitan nga ako.
Napilitan nga tayo mag-TikTok, diba?
Against our will.
So, aside from COVID work, a big bulk of your work also is doing health campaigns. Can you tell us more about that work, Meng?
Okay, so dun sa health campaigns naman natin. So as a background, no, DOH is very committed to lead the country in developing and producing yung mga communication materials natin, which are resilient, syempre equitable, people-centered, and stuff like that, no? Towards our goal na by 2022, tayo ang pinaka-healthy sa Southeast Asia. And by 2040, full Asia!
Angeli, don't laugh.
2022 na.
Well, baka kailangan natin i-move. Pero yun yung vision natin. So with the Universal Healthcare Law, the department is directed to increase its efforts dun sa ating health promotion activities. Hence, na-transform yung dating service into a full-fledged bureau. So bureau na yung health promotion ngayon. But before we actually do campaigns, we need to ground ourselves. No? So inisip muna namin, tinignan namin, what makes a Filipino healthy?
Right.
So nung nakita namin, what are the factors that affects the health of a person? Nakita natin na 20% is actually on the healthcare services being delivered to them. So ito yung mga serbisyo sa mga RHUs, sa mga barangay health stations.
Essentially when
hospitals,
people get sick.
When people get sick, no? Kung ano yung kailangan nila. And that is 20%. And when we see our budget expenditure, halos lahat napupunta doon.
Mm-hmm.
And we have that 80%. Ano ba the 80% ito? These are your social determinants of health. So ano itong mga SDH na to? It's your socioeconomic factors. Saan ka ba graduate? May katama ka mga education, Meron tayong mga physical environment. Saan ka nakatira? Sa city ba? Sa rural area? Sa urban area? Nandun rin yung mga healthy behaviors natin. Are you a smoker? Kamusta yung safety mo when you do your sexual acts?
Right.
Nag-breastfeed ka ba? Yung alcohol consumption mo. So these are actually 80%, no? Na actually kung titignan natin, kung magbibigay tayo ng parallel efforts and emphasis on the 80%, we could have a complete picture of a healthy Filipino. So with that, nakita natin na we need to have a multi-sectoral approach on that 80%. We have to admit the Department of Health or even the health sector cannot cover that 80% kasi social determinants of health to eh.
Right.
Yeah.
So economics, we have food security, we have the different factors,
Education.
ang dami. So kailangan ng multi-sectoral factor. And our campaign focuses on that particular thing, dun sa 80% na yun. So we really envision a healthy Pilipinas, no, na kung saan yung mga individuals are health literate, they are health-seeking individuals, and of course, may parallel na they should be in a health-enabling setting and there should be a health-supporting governance.
Mm-hmm. Yeah.
So yun yung thrust namin. We use this people and places framework kung saan yung activities ng campaigns namin would focus on the people, of course, with something on the governance structure. Dun sa environment nila.
Mm-hmm.
And since we're talking about your team in the Health Promotion Bureau, can you tell us more about their backgrounds?
Yeah, balita namin na parang hindi yata mga doktor ang nasa team mo, di ba?
Yes, very, very interesting. Dun sa team namin, just recently kasi may dumagdag na isang doctor, no? Pero before a doctor went in our team, ako lang yung healthcare professional doon.
Ooh.
And the rest are non-healthcare workers. Professionals ha? Sorry. I just need to qualify that. So itong mga to, they come from different background. Meron from marketing, meron mga interior designers. Yes. May mga landscape artists. Mga ganito siya. Yes, tapos mga social marketers.
Right.
So ganun sa corporate world. So yun yung mga type of people who's in my team, no?
Yeah.
But then again, balik nga tayo dun sa 80%. Dun sa 80% na sinasabi ko what makes Filipino healthy, multi-sectoral siya. So kailangan ma-mirror rin yun ng team namin. And it's not all about doctors and nurses and midwives, but it needs to have a multidisciplinary team to cover everything.
So Meng, as a doctor turned public health professional, I'm sure you'd want to encourage students in med school and even newly graduate doctors, no? So what can you say to them to encourage them to join public health?
Actually, if you want to join public health, no, siguro sabihin ko muna yung prerequisites before entering. Mamaya ko na sabihin yung mga perks. But you need really to define yourself when you enter this specialty, no? So you need to know who are you, yung mga existential questions, na what is your vision, what is your North Star, ano ba yung mga principles na non-negotiable when I'm put in this scenario na it's a hard no, or I could consider it, or yes na yes, no. Because when you define yourself, you won't get lost in the system. So kahit anong itapon sa'yo, okay lang. No? With that comes with the perks, no? If you've defined yourself, na alam mo na kung anong trabaho mo dito. The perks is actually the realization that you were a part of the health of a certain individual.
Right.
Kasi kung walang health comms, hindi kompleto ang repertoire of the services of the Department of Health or even the health system. So kailangan meron palagi. You're always a part of that, and the wins of the people, the health of the people is your win. Alam mo, medyo very self-realization and actualization yung benefits niya. But yun talaga eh. I won't say it's the compensation. It's not the money. Diyos ko, wag kayo sa public health. Pag pera-pera lang kayo. Wala kayong makukuha. But it's more of the actualization. And at the end of the day naman, if you're gonna die, palaging isipin ng mga tao, ano ba inambag niya sa mundo? Diba? Yung palaging question, it's your legacy that you will leave behind.
So Meng, what other opportunities in health communication that newly graduate public health students and med students can take advantage of?
Okay, so I have to be frank, no? Wala talaga siyang big opening for health communications. Kasi it will always be entangled or it's always be a part of a particular program or a particular activity. So walang diretsong health comms talaga. Unless of course you're going to development partners who have this particular siloed na mga portfolios. But if you want to have a part of health communications, you just join public health in general. Kasi it will always be a part. Communication will always be a part. And if you're excelling in it, there's a trajectory, a direction for that. You go to the health education and promotion unit of the different CHDs, of your hospitals, of your RHU, and of the central office. So yun yung mga talagang specialize on health communications.
So sabi mo nga, happy accidents.
Yeah. So parang don't be afraid in going into uncertain conditions that might lead you to accidents, because those accidents might be happy accidents.
Yeah. But honestly, to me, it really looks like a blessing in disguise. I mean, you said you're very interested in design even before, and now you're in health communications as a doctor, but also as an artist, really.
Okay, baka you have other parting words or advice that you want to shout out there to our listeners?
Yung parting words ko siguro for health communications is that if you really want to be a good communicator, you always need to be in the context. Not know the context, but in the context. Because sabi ko sa human-centered design, the first step is always to empathize. So you need to feel what they're feeling. You need to know what are the actions that will be done, what are the hardships. So kailangan you'll be in the community. When you're in public health, hindi ka pwedeng nasa upuan lang, nasa desk job ka lang. You will always need to have an exposure to the real world. And public health practice and public health work is all about that. It's a good mix of ideation. It's a good mix of knowing the people. It's a good mix of everything. Good mix of love. Learn. So yun lang. So if you're going to public health and health comms, explore everything. And yun nga, don't shy away from uncertain things that could lead to happy accidents.
All right.
We had fun, Meng. Thank you. I think we packed in a lot of insights today. But of course, we would like to send off our listeners with a little something more to scratch the itches of your curious minds.
Yes, it's finally Jqw Book Club time. Once again, we're giving you 2 new book recommendations from Dr. John Wong himself. Starting with Stuck, How Vaccine Rumors Start and Why They Don't Go Away by Heidi J. Larson. Vaccines have a long-standing rep for being one of the best measures to protect us from diseases and outbreaks. But actually, even with all we know today, there's still the big looming issue of vaccine hesitancy. Herd immunity is hard to achieve when you're met with a lot of resistance. And it's very interesting how beliefs sometimes take precedence over facts. And truly, since no medical intervention is free of risks, rumors start. Author Heidi J. Larson sees our vaccination programs as one of the biggest worldwide social experiments in collectivism and cooperation in modern times. And she draws from established information to dissect issue further down to more than just problems of misinformation, but problems in relationships with institutions.
And anyone who has ever had to write or talk about science must have a copy of the Chicago Guide to Communicating Science by Scott L. Montgomery on their bookshelf. Whether you're doing your thesis or you're about to talk at a conference, this is a practical guide to help you navigate words, science, words plus science, but more eloquently. Neil deGrasse Tyson himself would be jealous of your science communication skills after going through this book. Otherwise, you can just fake it till you make it.
You know, Angeli, parting is such a great sorrow. But not to fret, there are more PhD episodes to come. Thanks for listening to this episode of Public Health on Duty. You can find us on Spotify, Apple Podcast, Google Podcast, YouTube, and anywhere you get your podcasts.
Public Health on Duty is a joint production between Epimetrics Inc. and Big Baby Studios. Dr. John Q. Wong is our executive producer. Editing and hosting by Angeli Magdaraog and Martha De La Paz. Our producers are Abigail Tan and Antoinette Mendoza. Sound engineering and original theme music by PV Nicolas.
You can find out more about Epimetrics at www.epimetrics.com.ph or at EpimetricsPH on Facebook and Instagram. This has been Martha. You can find me on Instagram at _callmemartha.
And I'm Angeli. I am not on social media, but you can catch Martha and me on the next episode of Public Health on Duty.